the vision is to ensure that everyone involved in our community is safe, and we do everything possible within the limits of our environment to minimize suffering within our community. And that we work in close collaboration with other institutions in Maury and beyond to make this possible. And that we maybe come back to recognizing the aspect of the Findhorn community that was always geared towards being a healing community. So providing consciously an environment for inner and outer healing for all of us who live here and all of those who visit us. Preventing further trauma, responding, intervening where trauma becomes mental dis-ease, mental unwellness, and supporting each other to recover in those moments. Yeah, and then the policy would have 3 different layers. The one for individual health and well-being, which Cornelia and others have been working on for a long time, Laura, many others. And here we spoke about really 3 different levels, like caring, just bringing this trauma-informed knowledge that we've built to the notion of care, that each of us becomes a node of self-care and care for others in our community, where we open our sensing instrument, this beautiful nervous system, to become more and more aware of others around us and how they are feeling, how I am feeling, reaching out for help when I need help, but also noting when I have a concern for others. So it's care and then note and then relate, these 3 steps in the individual health and well-being, where we note if we don't feel completely safe about someone else in our team, in the community, where we feel that somebody might not be as well as they're trying to make it seem, or we see that they're withdrawing. And we cultivate an atmosphere where we can also perceive these individuals as an expression of the whole, and then we relate either directly to the person that we're worried, concerned about, to find out what the support around them is, or if that's not appropriate, to build a first line of support in the community where we can provide more support for each other. So this is something that has been there in the past, and that that is being recreated and strengthened at the moment in a cross-organizational way. And the second level is one where we'd really love your support and your help, which is, and this is new, the level of collective health and well-being in the community. And again, we have these 3 steps of caring, noting, we could also say sensing, caring, noting, and relating. So becoming a node of care for our teams and our organizational fields, and really starting to read our community more as a constant practice. And we started doing this together when we looked at organizational resilience. And from the beginning, like, when is our community becoming more polarized? Where do we see herds of conflict arise and cycle? Where do we see groups of people withdrawing in an unhealthy way? Where do we see polarization between the community and our larger environment emerging? And how might we weave there? But also, part of this care or this noting might be realizing, oh, you know, we've been functioning within fields of collective trauma, but we actually haven't been allocating time and energy to look at those recurrent themes in our community together, or the larger fields that we work in. So really to allocate resources, time, energy to note. And I think the biggest question that is still open is, how do we relate around this? What are the systems in our collective field? You know, we have a whole group of individuals that are trained in terms of individual mental health, and that might be able to support if it's more about an individual. And we have a whole other group of people who've been very trained in looking at health of community in terms of process work, many other tools that we're working with, you know, the training that Anna Rhodes is doing, many other trainings that have been here. So we have a lot of people with great skills. And why I was also reaching out to Hannah is I think it's really important here to relate to the NFA and to the original pastoral role of the listeners and conveners, you know, but how can we create that? And then in parallel, as a third strand, to develop an ongoing curriculum for health and well-being. And this was started 3 years ago and then kind of fell asleep a bit during COVID. And we could say that the trauma-informed leadership course was also part of picking up that curriculum for health and well-being.